Clearly, a broken shoulder can cause shoulder pain. So if you've had a fall or a severe injury and your shoulder looks deformed or you can't move it at all, you should seek emergency medical help. However, there are lots of other causes. For instance, frozen shoulder. We tend to think of stiffening of your shoulder with frozen shoulder, but actually in the first few months, pain is often the most marked symptom, although you often, as time goes on, start to get stiffening. You can also have something called a rotator cuff disorder. So your shoulder is really complicated, and there's a combination, a little sort of circle of muscles and ligaments that surround it. And rotator cuff problems can cause pain, particularly when you do certain movements. Osteoarthritis, the kind that causes low back pain and hip and knee pain, does happen in your shoulder, but it tends to be less common than in other joints of the body. Pretty much all, apart obviously from a break, of the pains in your shoulder can, at least in the short term, be relieved by rest and by seeing your pharmacist for help about painkillers, anti-inflammatories and so on. However, it is really important to keep your shoulder moving, because if you do keep your shoulder still for any length of time, it will stiffen up, and that can cause much bigger problems in the long term.